Hello everyone, welcome back to the new video, and today as you can see on the screen we are discussing about the hygiene and social medicines. So hygiene and the social medicines, this is very, like we can say, the subjects that everyone have the problems, and this is regarding the croak to those who are studying in the Ukraine or those who are doing the online exam. This video is for them. So for hygiene and the social medicines, there are the many, like it is a vast topic. It's like the same as the PSMs, but like same like the community medicines. So means that if we having the hygiene and the social medicine, it is a very vast topics, and it's very hard to cover each and every topics, and also we don't know what questions should be asked in the final exams, what can be the ministry what ministry can be asked. So there are loads of the stuffs like this, but in this video I try to put the some important and like that is useful. Maybe I'm not saying that 100% will be come from this PDF, but if it will come, that around 1% I can't take the guarantee, but around 99% I can say that it should become in your exams. Again, I'm not saying that it will become or not, but I try to put all the important points, all stuff that was on the ministry website, and like related to that topic, because I saw the hygiene base and the social medicine that was not asked in the from the last many years. And so there was some question that has commonly asked there, and they put the some new question that no one knows about those new questions, and we have to figure out those questions. So best advice for those questions that you don't know, just put any options, like whatever you prefer, whatever you think that it should be the most uh, good options and the most better options, so choose that option only. Otherwise you don't have to choose any other options. But so let's start this PDF, and we will keep discussing these questions. And so let's start from the hygiene and the social medicines. I put all the questions randomly, like what I thought that it would be the important for the exam. Rest subjects, please make sure that whatever the therapy, whatever the obstetrics or the surgery or the pediatrics, please make sure that you are perfect in those subjects, because hygiene and social medicine, if you don't know anything, it will be no problem. But you should be have all the knowledge of all the subjects. Like you should have at least, if you can't do the fulls, you should have at least the basics knowledge of all the subjects. So that is my concern. And so let's start with this PDF. So let's start from the first things, and the first things I got that there was a occupational disease. That was the occupational. This is my email ID, like this is my Insta ID, that doctor at dot medic mukuls. You can follow me there, and if any query you can write me also there. So occupational disease, we having the first one, that is the BC. Firstly, you should have the focus on all the occupational disease. I didn't write all the occupational disease, I only wrote what was in your hygiene PDF. So all occupational disease must be very clear in your mind. So if your question has been coming about the BC, so in the question they will give you exposed to the dust from the flax seed, cotton, yarn or the hemp. If you see like such type of the exposed, so the person has been exposed to the flax seed, person has exposed to the cotton seed, person has exposed to the yarn seed, person has exposed to the hemp. So in that patient we see the occupational disease, that is the BC will be there. All these occupational disease we give a common terminology, that is the pneumoconiosis. That is the pneumoconiosis. Can you tell me pneumoconiosis कैसी होती है? Is it restrictive होती है या फिर obstructive होती है? तो कैसी होती है ये? Restrictive होती है, ठीक है? Restrictive होती है, restrictive lung disease. Restrictive lung disease. Restrictive lung disease में क्या होता है? Inspiration affected होती है और expiration affected होती है. Inspiration affected होती है, ठीक है? That you need to remember. अब देखो, other terminology they will give you in the BC. The firstly they can give you the Monday fever, or they can give you the Monday asthma. The Monday fever or the Monday asthma, when they will give you such type of the things, so remember they talking about what? BC. Okay, so remember the BM means BC and Monday fever or Monday asthma. BC, Monday fever, Monday asthma. Just keep recalling with me, keep revising with me, so that it will be the easy to grab and easy to recall at this particular, in 1 hour we will finish this. Silicosis we will be having, like if you see the crystalline silica dust, if you see the crystalline silica dust, and keywords you will see like the mining, if they're having the silica formations, and that person will be exposed to that. There will be the quarrying and sand blasting. So mining, quarrying and sand blasting, mining, quarrying, sand blasting, mining, quarrying, sand blasting, mining, quarrying, sand blasting. So remember all these keywords you will get in their questions. So what will be the answer? The silicosis. Now see, there is a one silly mistakes that you will do in the exam. In the first question they will give you the anthracosis in the first line. After that, in the second line, anthracosis, like the if it is related to the coal particles or the carbon particles, then they will give you anthracosis. In the second line, the person also suffering from the crystalline silica dust, that is the silicosis. So what you will see, you will just read the first options, and in the options you will correct the anthracosis, but that will not be the correct answer, and you will say that I studied everything, I did study everything, I was sure about this question, but still my answer is incorrect. Why? Because the answer is what? Anthracosis. So don't do this type of the silly mistakes. These type of the silly mistakes you can easily conquer when you will do multiple questions practice on the test center website. So your silly mistakes will be reduced day by day. After that, the silicosis, remember they can give you another word, that the procylene. That what are other words they can give? Procylene can be given. Okay, next one. Next one, they will give you saturinism. Saturinisms when they will give, so remember they talking about which one? There is a lead poisoning. Saturinism matlab lead poisoning. Saturinism matlab lead poisoning will be there. Now this lead poisoning, they will give you very beautiful keywords, that the foundry workers. If the person is the foundry worker, that means that he is exposed to lead, and the persons will be having the saturinism. If you see the person is working with some battery, so he is a battery attendant, he is the typesetter working on the typesetter print shop, he is working on the typesetter print shop, and the person is exposure to the lead based paint, exposure to the lead based paint, pigment or the metal. So saturinisms, lead poisonings, battery attendant persons, typesetter, print soap, exposure to the lead based, because in the paint we see there is a lead particles will be present, and when this person exposed to the this paint, so there will be the saturinism will be there. Along with that we can see the pigment and metals, like lead we have the metal also, so that person will also get the saturinism. The lead poisoning will be same. Okay, till here everything is clear. ठीक है. Now remember the saturinisms we cause the porphyria. In the third year we discussed that there is a something porphyria is there, erythrocytic porphyria. So all that you need to remember. There is vitamin B6 deficiency, all these things we discussed. So that is the, remember, just remember the lead poisonings, it causes the porphyria. What are the signs we will see in the saturinism? The sign, the colicky abdominal pain. Like if someone is having the, if colicky, like chubne wala abdominal pain hai, pink gray stripe on the gums. Very important keyword. If you see the pink gray stripe on the gums, pink gray stripe on the gums, and what we call these lines, these are known as the Button's line. क्या बोलेंगे? Button's line. क्या बोलेंगे? Button's line इनको बोलेंगे. तो Button's line, remember, sometimes they will give you directly the Button's line, or sometimes they will give you the characteristics of the Button's line, that is the pink gray stripe on the gums. But if the pink gray stripe will not be in the question, they will give you dark blue border. Dark blue border, remember, that is also the same things you will see. Along with that, there is a very important feature, so very important sign we will see in the saturinism. क्या देखेंगे? Basophilic stippling will be seen. So can you just revise with me? In saturinism, what we will see? The lead poisoning. Saturinism, lead poisoning. Can you tell me the sign? Colicky abdominal pain. There is a colicky abdominal pain will be there. Okay, there is a eosinophilic stippling. No. Basophilic stippling will be there. Which stippling? Basophilic stippling will be there. ठीक है. After that, the pink gray stripe on the gum, Bruton's line will be there. If you see, there is one question in your PDF, that the dysentery patient, if there any disease, like in the question there was a dysentery, so I took the dysentery. If you see any disease having like emergency conditions, So which document will be required? So remember, for that we have the urgent report is required. Urgent report is required, and this urgent report is used to diagnose and to control the spread of the disease. Because this is the emergency condition, we have to diagnose this condition as much as possible urgently, and we have to control the spread of the disease. That's why which report will be given? That the urgent report will be given. Okay. Now the next question. Next, there is some question regarding the vibration disease, granite query. So what is vibration disease? Like if I'm vibrating, so that is a vibration disease. This vibration, when it will occur, like if I'm drill machines. If I am putting a hole with the help of the drill machine, so my hand will be vibrate. So pain or the, if this condition, like the person who is working with the long time, so in that we will see the pain or tingling sensation will be seen in the hands. Pain or tingling sensation in the hand disappear after the 15 minutes. It will disappear after 15 minutes. Can you tell me it is associated with which condition? Sir, drill machine. So drill machine means vibrating tools. It is handheld vibrating tools. If any vibrating tool is given in the questions, machine is something, they mentioned any machine, they mentioned any drill machines, or they mentioned any vibrating tools, that the tool that is vibrating. So all these are related to the vibration disease. Along with that, the person will be headache, there is an increase in the blood pressures, and positive white finger test. So remember this one, this is a test that we used, the positive white finger test, because the fingers will be looks like the whitest because of the keep vibrating the things. Vibration disease, pain or tingling sensation in the hand disappear after 15 minutes, associated with the handheld vibrating tools, headache, increased blood pressure, positive white finger test. So that is done. ठीक है, it's clear. After that there is a granite query. अभी देखो granite, this is the query, it's not query, it's query. The granite dust exposure, if you see any in the question, you see there is a granite dust exposure हो रहा है. अगर granite dust का exposure हो रहा है, so it means that there is a, which condition will be possible, that the granite query will be there. And remember that this granite dust, it have the fibrogenic effect on the lungs. So all these things you will get in the questions, and they will ask you which condition is that the granite query will be there. ओके, यहाँ तक सबको समझ में आ जाना चाहिए, नहीं आया तो समझ लो. अभी देखो नेक्स्ट वन, बेंट ओवर माइनर्स. नेक्स्ट क्या है? बेंट ओवर माइनर्स. नाउ बेंट ओवर माइनर्स, रिमेंबर द कोल माइनर्स हु वर्क इन द बेंट ओवर पोजीशन. द बेंट ओवर पोजीशन, ठीक है, बेंट कब कराते हो तुम बेंट, that is coal miners who work in the bent over positions, and this is seen, it is associated with which condition? Lumbosacral radiculopathy. So can you write me in the comment box? We discussed, those who watched the pharmacological drugs video that we have just published 2 days before. So lumbosacral radiculopathy, so this is like which treatment will or which drug will be given in case of the lumbosacral radiculopathy, and which drugs will be given in the sciatica. So write me in the comment which drug will be given in the sciatica, which drug will be given in the lumbosacral radiculopathy. Okay. Now what you see, bent over miners, coal miner. They are the coal miner who work in the bent over positions, because they are just digging the coal. So that's why they will have to bend. So those people, they have the bent over, and they have the problem here in the back side. There is a lumbar sacral region. So there is a problem in the lumbar sacral regions, sacral vein there. So lumbar sacral radiculopathy will be damaged, will be associated with it. After that, there is one more, that is ethylene glycol. So ethylene glycol, when the person ingests the ethylene glycol, let's suppose I ingest the ethylene glycol, what I will say? I will having the seizure. Seizures will be there. Now this ethylene glycol, it is a toxic substance. This is ethylene glycol, it is a toxic substance that have the neurological effect that will lead to the seizure. ठीक है, ethylene glycol seizure. Toxic substance they found in which condition? Antifreeze. They used for the antifreeze condition. They break the fluid. They used in the antifreeze conditions and they used to break the fluids. Now there is a one other simple question about the heat transfer. So heat transfer, remember the convection, radiation, conduction. So if you see the transfer of heat through movement of air or the fluid, convection. If heat through the electromagnetic waves, radiation, and iron rods or any water, they are having the conduction property. Okay, so these things you already know, so no need to remember. Then poisoning. The poisoning, again they ask you, mainly they will ask you the manganese, they will ask you the molybdenum, they will ask you the amalgams. After that there is amalgam, mercury poisoning will be there, benzene. Okay, so amalgam, remember there will be the amalgams. If you talk about the amalgams, so remember there will be the mercury poisoning. So amalgam means that is the mercury poisoning will be there. Then after that the benzene. So benzene we see the B for benzene, B for bone marrow suppression. Oh my god. So bone marrow suppression में क्या होता है? Bone marrow suppression there will be the aplastic anemia will be there. क्या होता है? Aplastic anemia will be there. Okay. Okay, so we see that there is a amalgam mercury poisonings, benzene cause the bone marrow suppression, and we know, sir, there is a one drug also though that causing the aplastic anemia. So which drug is that? That is which one? Which one? Which one? Which one? Okay, write me in the comment box that the chloramphenicol. The chloramphenicol they also cause the aplastic anemia. Okay, then this aplastic anemia, they can give you the hypoplastic anemia also. They can give you the hypoplastic anemia. So they having the non-regenerative hypoxia. They cause the non-regenerative hypoxia. So this is the aplastic anemia. Then benzidine. Benzidine it cause the bladder cancer. Benzidine क्या करता है? The benzidine it cause the which cancer? Bladder cancer. It cause the which cancer? Bladder cancer. Benzene cause the bone marrow suppression. Benzidine cause what? Bladder cancer. Very important is what? That the manganese. Very important is what? That the manganese. Manganese, remember there is a tremor will be in there. The patient will be having the difficult walking. What we call this condition? Gait. Now there will the facial muscle spasms will be there. So person will be having the forced laughter. The person will be having the forced laughter will be there. The person can't able to laugh. He wants to laugh but he will not able to laugh. So unfortunately there will be the forced laughter will be there in this patient. And this due to see there is a tremors, there difficult walking, there gait problem, the facial muscles. So you have seen that there is a muscular problem also, neurodegenerative problem also, muscular problem or the neurological also, and other condition also associated with this disorder. That's why they having the complex type of morbidity. The complex type of health effect will be seen. The complex type of health effect will be seen in manganese. Now the person who is electro-welders. The person who is electro-welders. So what we'll see in that patient we see the metal fume fever. Electro-welders. Electro-welders which fever? Metal fume fevers will be there. Which lungs will be there? That the welder's lungs will be there. Okay, electro-welder, metal fume fever, which lungs will be there? Welder's lung. Which lungs will be there? Welder's lung will be there. Okay, okay. After that, infrasound, it exerts the pressure on where? Eardrum. This is a direct question that I took. So electro-welders, welder's lungs, metal fume fever, infrasound exert pressure on the eardrums. Remember there is a one terminology called kaffir. There is a one terminology called kaffir. So kaffir, remember this is stored for 36.5 hours where in the medical establishment. KEFIR, remember the KEFI kaffir, it is stored for how many hours? 36.5 hours where in medical establishments. Okay, then next question, the double chlorination. The double chlorinations. So what is the double chlorinations? We will see in double chlorination this is used for which condition? Water disinfections. Double chlorination it is used for which condition? Water disinfection. Okay, Okay, after that we have the double chlorination. Double chlorination, remember, used for the water disinfection. Double chlorination we use for the water. This is actually the best procedure that we use. So this is used for the water disinfection. After that, there is a principle of ignition. The principle of ignition is there. So principle of ignition, remember, there is a consistency and reliability in initiating the combustion. So principle of ignition is based on the consistency and reliability in initiating the combustion. So that is the principle of ignition. The principle of ignition is what? It is based on which condition? Consistency and reliability in initiating the combustion. There is a one potato sprouts. What are the potato sprouts? What are the answers that will be used for the potato sprouts? What is the sola 9? Sola 9. What you use? Sola 9. Then tetraethyl lead. Tetraethyl leads. So the tetraethyl leads we discussed already. Then there is the keyword that you will see where you will expose to the tetraethyl lead. So remember, the gas station or the para-aesthesia. You will expose to the tetraethyl leads in the gas stations, and it is associated with which condition? That is the para-aesthesia. So tetraethyl leads, it is exposed from the gas stations. The gas station have the combustion of the tetraethyl leads, and along with that you see there is the patient will be having the para-aesthesia will be seen in these conditions. So always remember, the results happen over the times, not overnight. Result happens over the time, not overnight. Work hard, stay consistent, and be patient. This is the time that you have to work hard. You don't think that one day, one night you have work hard and everything will be solved. No, you have to be the consistent and just be patient, because whatever you are doing great. Whatever you are studying, you are doing your 100%. You are giving your best. So just stay consistent and be patient. Positivity is very important at this point. You have just minimum very few days, like 20 days or just 30 days. So just be patient and be positive at this moment. Don't worry about anything. Just keep studying and keep consistent in your study. Okay. Okay, so let's continue with the index. So firstly we have the index. The index, they will ask you the genital index, and secondly they will ask you the common morbidity rate. Now the common morbidity rate, remember, the disease registered among total population in an area. Like for example, if in my hospital there is 100 people are there and total population is 1000 people, so it will be the disease registered is 100 and the total population is 1000. So this will be the rate. So that will be the common morbidity rate. Then always remember, the rate we multiply with the 1000. Rate we multiply with the 1000. So it will be 100 divided by 1000 multiply 1000. So it will be 100. Common morbidity rate will be there. After that, there is a correlation factor. Now see, if we talk about the correlation factor, so there is that is the relationship between the phenomenon or any factors, like correlation between the service record and eosinophilic concentration in the blood. So that we talk about the correlation factor. So it is telling us about the correlation, like it telling us some correlations between the two things. So correlation between the phenomenon or any factor, like example what I told, that is if any service record, so there is a service record is there, and in service record what we have mentioned, what are the eosinophilic concentration in the blood, that we have mentioned, and that tell us about the correlation factor. Then after that we tell about the correlation coefficient. The correlation coefficient will be there, and the correlation coefficient, remember, that is 0.0 to 0.29 will be the weak correlation coefficient, 0.3 to 0.69 that will be the moderate correlation coefficient, 0.7 to 1.0 that will be the strong correlation coefficient will be there. So correlation coefficient, can you remember, 0 to 0.0 to 0.29 that is the weak correlation coefficient, 0.3 to 0.69 that is the moderate correlation coefficient, 0.7 to 1.0 that is the strong correlation coefficient. ठीक है. अभी after that there is a one more important terminology, that is the students criteria. ये भी बहुत कंफ्यूज करता है बच्चों को. तो स्टूडेंट क्राइटेरिया, रिमेंबर, जब हम किसी दो ग्रुप को के अंदर डिफरेंस बता रहे हैं, when we are telling the difference between the two groups, so that is telling the, that is what student criteria. Now see, Sometimes they will give you loads of the morbidity and they will ask you which is the intensive indicator, which is extensive indicator. So remember that if the intensive indicator, the birth rate, overall mortality, infant mortality, morbidity rate, disability rate. So this is what intensive indicator. So you need to revise all these things. BOIMD, boy in DM. So boy in DM. DM means that is a district of magistrate, or MD, boy in doctor of medicines. The boy in MD. The boy is where? Where is boy? Boy means boy. So boy is in where? The boy is in MD. The boy is in MD. In MD department, who is that? Boy. So what is the boy? B for birth rate, O for overall mortality, I for remember the infant mortality, M for remember the morbidity rate or the disability rate. तो all are the intensive indicator. अभी intensive indicator की definition जान लो क्या होती है. अगर कोई intensity या concentration of phenomena within a given unit of measure, like for example the birth rate, when calculating the birth, total amount of birth in total populations multiply 1000. So that is the intensity or the concentration of a phenomena, is the concentration of birth within a given unit of measures, like within the total populations, within the total birth periods or the total birth in the populations. So that is telling us the intensive indicator. So that is, we have to calculate with a given unit of the measure. So all these are what? Overall mortality, infant mortality. Infant mortality means that how many infant died in, like how many children died in infant, we say 28 days to 1 year. How many children died in 28 days to 1 year divided by the total, total populations in 28 to 1 year. 28 days to 1 year, how many populations are present in the how many childs are there in the population, how many infants are in the total population, and how many infant died. So that tell us about the intensive indicator. Extensive indicator हमें क्या बताता है कि causes of the death, morbidity, disability structures, ratio physicians to the population ratio, average medical personnel ratio, ratio indicator or relative index. This is very important. If you see the relative index, you have to calculate the relative index of something. So that is telling the extensive indicator. That is the extensive indicator. After that, there is a one other terminology, that is the body mass index. क्या होता है? Body mass index. Body mass index. So BMI, that is the BMI. BMI means mass divided by height. So mass in kg divided by height in meter square. So that is the BMI. BMI is equals to mass in the total kilogram divided by height in meter square. And remember that normal value of the BMI is 18 to 23 kg per meter square. That is the 18 to 23 kg per meter square is the BMI. Okay, bye bye, tata. चलो अभी देखो, if less than 18 underweight, if 18 to 23, yes, that is the normal. 18 से 23 normal. The 18 to 23, 18 to 23, 18 to 23, remember this is our youngster age, that is the youngster age, like the 18 to 23 average youngster age, that is the normal. So that is the BMI will be the normal. क्योंकि देखो अगर इसको इस तरीके से समझे कि 18 से 23 में क्या होता है, अपना वेट क्या होता है, नॉर्मल होता है. 23 से 27 तक आते आते हम वेट थोड़ा सा गेन करना स्टार्ट कर देते हैं, तो ओवर वेट हो जाते हैं. उसके बाद 27 से 32 की उम्र में क्या हो जाता है, एक थोड़ा थोड़ा और वेट हो जाता है, पेट क्या हो जाता है, आगे की तरफ हो जाता है, प्रेग्नेंट होना स्टार्ट हो जाते हैं. तो 23 से 37 में क्या हो गया, ओवरवेट. 27 से 32 में क्या हो गया, ओबेसिटी क्लास 1 हो गई. क्या होगी, ओबेसिटी क्लास 1. अभी क्या होगा 32 से 37 की उम्र में, 32 से 37 की उम्र में और पेट क्या हो जाएगा, मोटा हो जाएगा, हमारी जो मास गेन हो जाएगा हर जगह पे, एब्डोमिनल एरिया के अंदर, लाइक एंड्रॉइड ओबेसिटी और गाइनोइड ओबेसिटी. फिर मोर देन 37 में ओबेसिटी बढ़ती चली जाएगी, फिर वो डायबिटीज शुगर वगैरह की दवाइयां स्टार्ट हो जाएंगी. तो वो सब चीजें होती रहेंगी. तो इस तरीके से इसको याद कर लिया. क्या याद किया कि 18 से कम साल की उम्र में अंडरवेट होगा, लेस देन 18 ईयर अंडरवेट होगा. 18 से 23 की उम्र में क्या होगा, नॉर्मल वेट. क्या होगा, नॉर्मल वेट होगा. 23 से 27 की उम्र में क्या होगा, हम धीरे धीरे वेट को गेन करेंगे, क्योंकि हमें अभी थोड़ा सा टेंशन फ्री हो जाते हैं, थोड़ा सा, ठीक है, पढ़ाई वढ़ाई से थोड़ा सा इधर उधर टेंशन फ्री हो जाते हैं, तो थोड़ा सा वेट धीरे धीरे क्या करते हैं, गेन करना स्टार्ट कर देते हैं. तो that is 23 to 27 we have to overweight. 27 to 32 ओबेसिटी क्लास 1, मतलब वहां पे क्या होगा कि हम बैठे बैठे रहते हैं, हम अपने काम के चक्कर में हम बैठे रहते हैं, जैसे फॉर एग्जांपल मैं यहाँ पे सिटिंग कर रहा हूँ, एनीवन हु इज डूइंग हार्ड वर्क। और आजकल का जमाना क्या है कि have the लाइफस्टाइल मॉडिफिकेशन हमारी क्या हो रही है, धीरे धीरे डाउन आ रही है। तो लाइफस्टाइल मॉडिफिकेशन अगर डाउन आ रही है तो धीरे धीरे क्या होगा, हमारे बैठे बैठे हमारा मोटापा आएगा। तो मोटापा के लिए क्या होगा, 27 से 32 की उम्र में क्या होगा, ओबेसिटी क्लास 1। उसके बाद फिर क्या होगा, 32 से 37 अगले 5 साल में और क्या होगा, मोटापा आ जाएगा। फिर अगले से 37 साल में क्या होगा, उससे और ज्यादा मोटापा आएगा, जिसमें हमें शुगर वगैरह की प्रॉब्लम, हाइपरटेंशन, ये अगर मोटापा अगर चलता रहा तो ये चीजें आती रहेंगी। सो दैट्स व्हाई यू हैव टू रिमेंबर ऑल दीज थिंग्स इन द डिटेल्स। याद करने की कोई जरूरत नहीं है। अंडरवेट होगा, फिर नॉर्मल होगा, फिर ओवरवेट होगा, फिर ओबेसिटी क्लास 1, ओबेसिटी क्लास 2, ओबेसिटी क्लास 3, बात खत्म, बात बाय टाटा। तो अब देखो टाइप, एक होता है फिजिकल टाइप और एक होता है पैथोलॉजिकल। तो फिजिकल के अंदर रिमेंबर कि एक होता है एंड्रॉइड, एंड्रॉइड के अंदर रिमेंबर एप्पल से, ए फॉर एंड्रॉइड, ए फॉर एप्पल से। तो एप्पल कैसा होता है, पेट, यानी कि जो पेट होता है वो एब्डोमिनल रीजन क्या होता है, मोटा हो जाता है। गाइनोइड कैसा होता है, पियर शेप, गाइनोइड कैसा होता है, पियर शेप, ठीक है। तो दैट द हिप रीजन्स विल बी द इनलार्ज और that is the android, the breast regions will be enlarged, so that is the gynoid, यानी कि pear shaped obesity will seen in the case of the pear shaped obesity will be seen in case of the female, and android obesity will be seen in case of the male. After that, be gentle with yourself because you are doing the best you can. So just sometimes we don't give us yourself reward, so just give yourself a reward because you are doing your best, you are everything, you are struggling a lot, but unfortunately you don't give this reward to yourselves. We forget that things, so just believe in yourself, that is the most important things. So be gentle with yourselves, you are doing the best that you can. After that we have in the weaving workshops. So this, if you see the waving workshop, so this is associated with a high frequency and intensity noise. So in that patient you see the occupational deafness will be there, the patient will be having the occupational deafness will be there, and you will see that's audiometry data. So what you will do in this condition, audiometry data, analyze the audiometry data and analyze the hygienic assessment of the working environment, like how much frequency is there, is the low frequency, high frequency. So that is telling, that is causing the occupational deafness. So for that we have to analyze the audiometry data and we have to analyze the hygienic assessment of the working environment. The camp, remember what we have, the several water resources. So several water resources, like if this is the right question, like if someone had put the camp and there is a several water resources is there, so what we have to do, from where we should the water, you should take the water that is the clean, that is the hygienic, little bit hygienic and good for the health. So that is the artesian well. से क्या होता है, कुआं, याद है कुआं खोदते थे, तो स्टार्टिंग के जमाने में हमारे पास क्या होता था, कुआं होता था, जिस कुएं से क्या होता था, पानी भरते थे और उस कुएं में से ही हम सब कोई लोग पानी पीता था. सो दैट इज द आर्टेशियन वेल्स, दैट इज द बेस्ट सप्लाई ऑफ द वाटर. After that, if you see, there is a lighting fixtures for hygienic acceptable. What is that? Lighting fixtures that provide the reflected lightings will be used for the hygienic acceptables and will be acceptable hygienically. After that, medical and preventive treatment facility. If you see in the question, there is a medical and preventive treatment facility. So remember, this deals with socio-medical assessment of the temporary disability. If in society you are seeing there is some temporary disability patient are there, so that you will do medical and preventive treatment facility will be done in those people or in those patients. After that, there is one question about the health group. So health group, remember there are the 5 groups, they are based on the Russian or the Ukrainian foundation. So 5 types, first health group, second health group, and further the third health group is divided into the 2 types, third A and third B, and sometimes we classified into the third and fourth and fifth one. So first health group, there is a healthy children will be there and adolescents, everything will be the healthy, harmonious development will be there, and the person will be sick less than 3 times per year. So that is the first health group. The second health group, healthy but less resistant, they have the low immunity, means more than 4 times sick, and for the long time we will consider it into the second health group. Third health group, the patient suffering from the chronic disease in the compensation stage. Now if the patient suffering from but there is a compensation stage is there, but normal physical conditions, like he is able to do some household work, he able to go for the work. So all that will be come under the third health group. After that, if we see the fourth health group, the chronic disease in subcompensation stage. Fifth health group, the chronic disease in decompensation stage. Means third health group, the patient has the disorder, but our body is having the compensation mechanism that is trying to compensate that disorder. Because like for example, we have the alkalosis, we have the acidosis. So in that condition, body will try to compensate, and the body will have to do, like the body will try to compensate with the decreasing in the heart rate, the there is a excretion, vomiting. All these things are the, like in the case of the, we have the increase in the hypertension, the RAS system will be activated. There is a decrease in the sodium, RAS system will be activated. So these are some compensatory mechanism that is present. That means that a third health group is there. But once the body start decreasing the compensation, so that will the fourth. If a decompensation stage, that is the fifth health group will be considered. Harmonious, we said that the harmonious development in the first health group. So remember the value of the harmonious development, you need to remember the +1 to 0 to -1. So all will come under the, like for example, if you get in the body length 147 centimeter, and in the bracket they are getting the +2. Body weight is 38 plus 1.5, chest circumference 72.5, and the harmonious value 0.2. Now when you will calculate, so this is more than equal to 1. So +2, 1, it will be more than equal to the 1. How much it will be? 2, 3 and 5 points. So it will be like around 3.7. It will be the 3.7. So it is more than equal to 1. So it will come under the disharmonious development. This will come under the disharmonious development, that is more than ±1. So always remember why you started. So when you came to Ukraine, when you came to your college, so just remember why you had started. Now this is the time to end all those starting. So you had the goal in your mind when you came. Now it's time to end this goal, because once these are the minor goals, that you will get your degree, you will get the doctor in front of your names. So that day is waiting for you. So are you ready for that? Are you working hard for that? Ask to yourself, and just keep going, keep growing, keep consistent, and be positive in this moment. Okay, now further let's continue. The prostate cervical cancer. If you talk about the, if any, like say if in the question they ask you, like the medical examination is done, they ask you which medical examination. So they mentioned like the target, like in the question they had mentioned the cervical cancer is there. So cervical cancer, remember which biopsy will be done. So that is a target biopsy will be done, because target biopsy, is there like the therapy that we use for the cancer patient, whether it is the prostate cancer or the cervical cancer. So this is the medical examination, and usually it is combined with the chemotherapy also. So that's you need to remember. The cervical cancer, prostate cancer, we do the targeted biopsy or the medical examination. If need occupation by any affected persons, so which rehabilitations will be done? So this patient has been, they're having some chronic disease, now has been fired from the any company or any branch. So if need occupation by an affected person, so what rehabilitations you will do? You will do the occupational or the professional rehabilitations. You will say that okay, you will get the degree, you will get the occupations, like that type of the rehabilitations you will do. To extend the duration of the medical certificate, so this is the also very common question. The Medical Advisory Commission after the MSCS, Medical Socio-Economic Commissions, So to extend the duration of medical certificate, we have to take the advisory after the MSEC. The most common to pregnant lady after the childbirth leave. So what are the 100% of the average salary? The 100% of the average salary will be given the pregnant lady. The medical certificate to the pregnant lady after the childbirth, we will, and the pregnant lady is on the leave. So on that behalf, we will give the 100% of the average salary will be given to the patient. After that, if you see the sick leave for the Chernobyl survivor, if anyone wants to give, like he is the Chernobyl survivor, and in the question they will ask you how many days sick leave he will get. So for entire duration of the illness, he will get the sick leave. So remember, hospital that will be the which type of the hospital for the Chernobyl survivor? There is a central block type. Which type? Central block type will be there, and the polyclinic will be near the entrance. Polyclinic near the entrance, we will see there is such type of the hospital for the Chernobyl patient. Central block type, polyclinic near the entrance. Now sick leave, if you want to take the sick leave, 5 to 8 days sick leave. So this is under the supervision of the department head, and the 10 months for the tuberculosis will be given under the department head. If you have the fracture injury, so in that we will have the medical certificate. The sick leave, we will be having the 3 to 6 days sick leave will be given. Average duration of the patient stay in the hospital, the number of the bed days. The average duration, how you will calculate, like for example, if in the question they have mentioned the number of bed days is 100 and number of the treated patient during the year is 300. So total average duration of patient stay in hospital, that is the 400. So number of the bed days and number of the treated patient during this year, that is the average duration of the patient stay in the hospital. Okay, is that clear? Then statistical record, remember, is used for the acute respiratory infection. The statistical record, it is used for the acute respiratory infection. After that, there is another one, that is the standardization. Standardization, remember, it eliminates the influence of the qualitative or quantitative heterogeneity on the intensive indicator. If you example, the eliminate the influence, like if any qualitative or the quantitative heterogeneity is given in the question, to eliminate on the intensive indicators, you know that the boy MD, the boy is MD, so that you need to remember the intensive indicator. For example, morbidity in different age groups, like in the question has been mentioned age structure of population is different in age district. So for that we having seen that age structure, so we have the different in each district, that is the quantitative data. Now age structure of the population is telling the qualitative data. So that why we having to eliminate the influence of the qualitative or the quantitative heterogeneity on intensity. Where the intensity is the morbidity. The intensity indicator is the morbidity, that we have to figure that out or eliminate that out. Student criteria or the student t-test. So it tells the difference between the groups that we have discussed already. That tells the difference between the group, that is the standardization is eliminate the influence, and student t-test tell the difference between the group. After that, there is a line graph or the linear diagram or the bar chart. So it depicted the change in the phenomena over the times. Like in the question they will mention, like in the past year there was some disorder was there, and now there is some disorder. So we have to see the changes in the phenomena over the time. What was the last year, what was the this year? So this is the changes that we have seen. So if any depicted the changes in the phenomena over the times, which graph will be used, that is the line graph or the linear graph or the bar charts will be used. For example, number of registered case of acute infection and their comparison to the average monthly value obtained for the 5 previous year. For example, this is a bar chart like this. Here one we have here. So this one we have the 2020, then 2021, 2022, 2023, 2024. So this is what, that is the line graph or the bar chart. Pie chart. The pie chart, that is the, or we have the line chart like this also. This also, like we have to measure like at is it increasing or decreasing, or like if it is decreasing, increasing. So we have to figure that out based on the like the value we had given. Pie charts, there is some circle things will be there, and this is the therapist. Like for example, like some therapist is there who spend X% on the time on this place, Y% of the time in the residential, 3%. So you have to, or your marks, like you have to go the in hygiene you got the 10%. You in the hygiene you got the 10%. In therapy you got the 20%. In surgery you got the 5%. In pediatrics you got the 80%. In pediatrics you got the 50%. Okay, so it will be like calculated like this. And there is one more things that you can say, like psychiatry for example, or the dermatology you got the 15%. So this is the marks distributions, like we have to use the pie chart. Then there is a one more, that is the radar chart. Radar chart, remember, they compare the two or more items or the groups on various feature or the characteristic. Various feature or characteristics, remember, various features would be there and there is a two or more item will be there. For example, we have to compare the two antidepressant drugs based on their efficacy, they are based on the prevalence of the specific side effect, based on the use of the patient. So this radar chart is used for the monthly deviation also. This is used for the monthly deviation also. For example, if you see the monthly disease morbidity and the dysentery, in the question they will give you in the November we having this percent, in January we have this percent, February we have the Y percent, the March you have the Z percent. So this type of the deviations you will see with the help of the radar chart. Okay. So keep going. Everything you need will come to you at the perfect time. I think perfect time is coming soon. So you have to just keep going, keep consistent, and you will get the better future. The synergistic, remember the interaction of the two or more drugs. When we have the interaction between the two or more drugs, when the combined effect is greater than the sum of effect when the drug is given alone. Like for example, if you are giving the two drugs, so the drugs, the sum effect of these two drugs will be more than equal to the 2. And potentiation will be equal to 1 plus 1 is equals to 3. That is the potentiation. Agonist is same affection like the receptor. For example, we have the beta receptors, like say beta 2 receptors, like beta 2 receptors, they cause the bronchodilation. So bronchodilation, for example, we will give that is the salbutamol. This is also the beta 2 agonist. So they will also cause the bronchodilation. Antagonists, they have the opposite action. They are also the physical and physiological, pharmacological, that we discussed in the third year, but they will not ask you this, that you just have to remember that there is some opposite actions will be there. The target therapy we have used for the cancer, cervical cancer, prostate cancer. Complex health effect is the manganese toxicity, disturbed gas, facial spastic, this we already discussed. Neurodegenerative weight, they also cause the Parkinson disease. Okay. So this is what all about the hygiene and the social medicines. I hope from this PDF you will get the questions in the main exams, and there is a note, I can't take guarantee of this, like there is a 100% surety that all the questions will be come from here, but there is a chances, the probability is that the 99% should be come from here, because they are the question that is given on the test center website also. So there is a little more chances, probability is high for these type of the questions will be there. Just you have to revise all those questions what is based on these facts or based on these keywords. So I hope this video help you, and please stay. Thank you for watching, and wishes you all the best. Please do subscribe these channels. If you have not subscribed these channels, please do it. And because it gives the motivations, and once you watch the video, once you comment, you interact with the video, it gives that I have the make it correct lines, and like it's giving the some motivations, like to keep doing all the stuff in the further on. So just keep consistency, and for any query you can write me on the Instagram at the Dr. Medic Mukuls, and also you can join me on the Telegram at the Medic Mukuls, the Study with Medic Mukuls. The group name is Study with Medic Mukuls, while the ID of the Telegram channel is the Medic Mukul 01. So just follow me on the Instagrams and ask me any query if you have. And so if the last quote for the today, it might feel difficult now. So now you are thinking, अरे यार क्या है क्या नहीं है. I don't think कि मुझसे क्या होगा क्या नहीं होगा, पेपर कैसा आएगा, पेपर हार्ड आएगा, पेपर इजी आएगा. Now this is not the time to think about it. It might feel difficult now, but you and your parents, and like more than you, your parents are waiting for you for this success. So just have to work hard. There is no other choice. So just keep working hard. But you and your parents will be so proud of you. And when you are done, when you will get your degree, you will say, I did it. I made this. And this is my time. This is my parents time, this is my family time. I make them proud. So just keep working hard and keep growing. So thank you so much again, and keep going the all the doctors in 1 month. Okay, so wish you all the best. Take care, and take care of your health, and have a good health. Thank you so much for listening me out. I hope I will see you again. And all whenever you got the results, please do share with me, and you can message me on my Instagram, you can message on WhatsApp, the Telegrams, whatever the compatible for you. So wish you all the best. Take care. Good night. Bye bye.